So John, welcome. Do you want to just start by just sort of telling us who you are and what you look at in your academic work?
Sure. My name's John Skinner. I'm a health economist at Dartmouth. I work in the medical school and at the college. And I'm very interested in regional variations, in particular in Medicare spending and what that says about waste and inefficiency in healthcare.
Perfect. So what's the issue for the brief? What are we focused on?
Yeah. So it appears to be from our research that there's quite a bit of waste and inefficiency in U.S. healthcare. But in this case, we're focusing on something that's very specific, which is healthcare fraud, in particular Medicare fraud. And that's something that we feel it's there, it's clear, there's no benefit whatsoever for patients, and there's only a loss of revenue from the Treasury to people who really don't deserve the money.
So what got you to start looking at this in the first place?
I've worked for many years with the Dartmouth Atlas Project, which is tried to look at differences across regions in Medicare spending. And certain regions would pop up in terms of very high spending levels. In particular, one town called McAllen, Texas, which used to look just like El Paso, and all of a sudden, it ended up spending twice as much as El Paso over the space of about 8 years. And it looked as if home health care was a major contributor to that difference.
Why do we think home health care is sort of a hotbed for fraud? What is it about home health that makes it different?
It's a great question. Home health care is virtually unregulated, and it relies essentially on the honesty of the home health care operators and the doctors to make sure that it's not used in an inappropriate way.
Was there an aha moment when you were looking at the data and you just realized this was off, something was wrong here?
Yes. When we looked at what had happened in the early 2000s, when Miami went from 70 home health agencies to 700, we knew there was something not quite right going on.
That this was fraud in all likelihood.
This was fraud, and it just seemed as if, surprisingly, like that people at Medicare, people at Department of Justice knew this was going on, but they didn't have the right tools to get back at it. And they've actually made a lot of progress since those days, but we think that there's a lot more progress that can be made.
So John, what should we do to address home health fraud in the Medicare program?
There are two basic strategies. One is to keep the fraud from occurring in the first place. And the second is to make it easier to bring to justice people who do commit fraud. And in both cases, we think that examples like letting doctors know how much is being billed on in their name by home health agencies is really important. Many doctors have no idea that their numbers and names are being used to justify a lot of this illegal billing. Another is to make sure that that in regions where there seems to be a lot of suspicious activity, which is very easy to determine, that questionable bills are not necessarily paid right away, but instead are tracked down. There are a variety of sort of fairly small, modest ways to change things that don't unduly penalize legitimate home healthcare agencies that we think can save a considerable amount of money.
What sort of savings are we thinking are available?
The estimates that we run range from $1.2 billion to over $4 billion in savings. We think these are fairly low on the conservative side because we think that there's actually a fair bit of gray area activity in a lot of regions that would likely decline once home health agencies realize that it's increasingly hard to kind of maybe sort of cut corners in terms of justifying whether patients really need home health care or not.